Great. Good afternoon, everyone. It is a pleasure to meet you. My name is Hassan. I am the Outreach Director for Muslim Americans in Public Service, or MAPS. MAPS is one of the nation's largest organizations for Muslims who are in some type of public service. If you are formerly a part of public service, currently a part of it, considering it, a contractor, to whatever capacity that you are a participant in public service, we would love to have you join our network. Joining right now is absolutely free. We will be posting a link into our chat. We are absolutely delighted that you're able to join us this afternoon. Tonight, we're going to be talking about a topic that is incredibly important to me personally. We are going to be discussing public health, and we're going to be discussing the roles that our community members have played within public health. Before I really get into the meat of it, there are a couple of announcements that I want to make. Everything that we say today is going to be within our own personal capacity and does not necessarily represent the views of our employers. The other thing that I want to start with before I get into it is that this type of planning or this type of panel requires a lot of work. And so I want to take a moment to recognize our partners who have been an instrumental figure of making sure that this is publicly advertised and really scoped well. And so I just wanted to thank the Muslim Public Affairs Council, Women of Color Advancing Peace, Security and Conflict Transformation, and American Muslim Health Professionals. If you guys have a moment, I would recommend that you check out their websites. They're doing incredible work, and we're incredibly lucky to have them as partners. We are also incredibly lucky to have our panelists today. I am going to cheat for a moment and have them unmute themselves and just introduce themselves, at which point I will give a little bit into their background, and then we can go ahead and get started today. I'm going to start randomly, I think, with Samir, if you don't mind unmuting yourself, and then we can go from there.
I don't feel like that was random. I feel like that was targeted. Assalamu alaikum, everyone. Thank you, Hassan, for having me. And Sadia, thank you for brokering the relationship and making the introduction. I'm definitely going to embarrass you a little bit, Sadia, in reference to work at the Beaumont. But my name is Zamir Brown. I work at the Beaumont Foundation. I'm a Muslim American, and a lot of times that isn't the most apparent to a lot of people. But in my work, I lead some programs in our people and our policy portfolio. One program being Healing Through Policy, which is about advancing anti-racist policies across the nation and supporting municipalities in doing that. And I also run our 40 Under 40 in public health program, which Sadia is a part of. So I need to tap in with her to figure out how I can do better in that role. But again, I'm really happy to be here. I'm going to let Hassan do more of the bigger, meatier background, but just want to say that I'm excited to be here, as a Muslim in public service.
Samir. Sadia, would you like to go next?
Sure. Thank you, Hassan, for organizing this and putting so much energy behind it. Samir, thank you for embarrassing me right off the bat. That was great. Way to go. Hi, everyone. Assalamu alaikum. My name is Sadia Makib. I am a Muslim American, born in India, grew up here in the States since I was about 5 years old. So got involved in public health and have just very early on in life when I was in college and just have loved every minute of it. So a really evolving career, but it's something that helps me find my purpose and definitely connects to my faith when it comes to how I think about service as a Muslim as well. So thank you so much for having me, and super honored to be part of this panel.
The honor, I think, is all of ours, and we really appreciate it. And then last but not least, Captain Nazmul, Hassan, if you'd like to introduce yourself briefly.
Assalamu alaikum. It is so great to see a group of Muslims. I think this is my first time addressing a group of Muslims, and I can't thank Hassan enough for doing this. We started with the chat, and for most of you who dealt with Hassan, it starts off a little discussion. All of a sudden, all this energy from him, it starts just transcending, and you are like in the mix of all this energy, and you're like, you know what, let's do this. So thank you so much. And I really appreciate what MAP's been doing, especially the last few Zoom meetings you guys been doing is phenomenal. The panelists, I don't think I reached that caliber, but most of the panelists I have seen so far are amazing panelists. So as you can see from my name, I am a Muslim and I am in uniform, active duty, 20 years done. So who knows, maybe retirement is knocking on the door. But thanks to be here. And again, looking forward to talk to you. I'd rather hear questions from you guys than me talking about myself. Thanks.
So a couple of comments about that. First of all, my energy is always constrained. It would never be what I would call manic. And anybody who would describe it as such, that'd be silly, right? So thank you for that. The second thing here is that all three of our speakers are incredibly humble people. I don't like to use the term heroes loosely, but each of them have incredible backgrounds, which I'll get to in a moment, inshallah. But I do want to take a moment to recognize that outside of our speakers, we have a community that's filled with individuals who have vibrant professional backgrounds, who have done so much to give back to their society. And that's really what we're going for here, to create a platform wherein individuals within our community can talk about both their identities and to the service that they have brought to their community. So the honor really is ours, and we're really glad that we're able to have this platform and that we're able to share this with everybody. So I would like to take just a couple moments, talk a little bit about the professional backgrounds of our folks. Then I'll go ahead and get started with some panelist questions. If you have questions for our panelists, I ask that you please put them into the chat box. What we'll do once we get to the end, we'll have a moment to see if any of our executive team wants to say a few words. If not, we will go ahead and we'll start with the questions in the chat box and we'll work our way down, inshallah. So I'm going to go, I think, in reverse order. Let's start with Captain Nazmul Hassan. So Captain Nazmul Hassan is a Commissioned Corps officer with the U.S. Public Health Service. He is the Director of IT Transformation. And I believe, please correct me if I'm wrong, there was a recent job change?
Yes, literally a month ago.
Yes. So what I have is a little bit old. So I'm going to read to you what I had originally gotten, and then I would love to give you the opportunity to correct me because your success should be celebrated. So this is approximately a month and a half old, so forgive me. He was the Director of IT Transformation in the U.S. Food and Drug Administration Office of the Commissioner, Office of Digital Transformation. He joined FDA in 2002 at the New York District Imports Operations Branch. He has served FDA Office of Regulatory Affairs in various capacities, such as the Program Division Director, Director of Investigations Branch, Chemistry Branch Director at Northeast Food and Feed Laboratory, Division of Import Operations HQ, as the first established Northeast Regional Activity Manager, Import Supervisory Consumer Safety Officer, Import Compliance Officer, and Import CSO. Outside of that, that's just us getting started, he is the recipient of several Public Health Service Outstanding Service Medals, Achievement Medals, Commendation Medals, Outstanding Unit Citations, and Unit Citations for his exceptional work with both the FDA and the Public Health Service. He is the recipient of the Public Health Service Chief of Engineers John C. Wilforth Leadership Award. He has also received the Public Health Service Global Health Campaign Medal and Foreign Duty Award for his public health work with the Department of Defense and the Public Health Service work in Papua New Guinea, Solomon Island, and Marshall Island. I'm going to spare everyone because this goes on for a little bit. I would like to return the floor to you for just a moment and just have you introduce your new position, if you don't mind.
So Hassan, no, you are correct. The IT position is my current position. So for everybody's awareness, for the longest time, whenever I ran into people and they asked me, so what do you do? I'm like, oh, I'm with the feds. The first response is, are you in IT? For 20 proud years, I've been saying no. I'm in enforcement and operations, but last month that changed. Now I'm like, yes, I made the brown profile. I am in IT. Back to you, Hassan.
We do love to serve our community members and their expectations of us. Let's go to Sadia. So Sadia McKeith is the Director of Community Health at the Trust for Public Land, where she advances the built environment and nature as underutilized assets and strengthening the public health. Sadia's portfolio delivers on innovative cross-sector partnerships to increase awareness and policy support for green spaces and incubates ideas to enhance impact. Her prior experience ranges from working in the private sector at Care First, Blue Cross Blue Shield to strengthening healthcare systems globally. She is a former CDC Public Health Prevention Service Fellow and Peace Corps volunteer. She also serves on Maryland's Community Health Resources Commission. She earned her BA in Public Health Studies from Johns Hopkins University, Master's in Public Health in Health Behavior, apologies, from University of North Carolina, Chapel Hill, and her doctorate from Harvard, I am forgetting, so forgive me, T.H. Chan School of Public Health, with a concentration in humanitarian studies, ethics, and human rights. Did I miss anything there?
Nope, that was great. Thank you.
Of course. And then going back to Zamir. So Zamir is a Muslim American entrepreneur, program management specialist, and a rising public health leader. He is the founder and chief executive officer of Speaker for Health, which is an international management consultancy that develops tailored strategies to actualize its clients' full potential to eradicate inequities and to heal society. He is also a senior program associate of people and policy at the de Beaumont Foundation, where he develops and manages solutions that bolsters the public health field and workforce to create communities where people can achieve their best possible health. Among the initiatives he manages are 40 Under 40 in public health, building expertise in administration and management, and healing through policy. He is a fellow for the Royal Society for Public Health. He holds a master's in public health degree from George Washington University, the Milken Institute School of Public Health, and then a Bachelor of Arts in Anthropology from the University of North Carolina at Chapel Hill, and an Associate of Science degree from Durham Technical Community College in Pre-Medical Studies. Whew. Okay, did I miss anything there? Okay, it looks like I'm good. I want to say, outside of that, each of these three individuals, when I spoke to them, expressed almost the exact same level of dedication to public health. And all three of them at some point in our conversation expressed a sentiment to ensure that the reason that we're doing this panel is to promote the public health of society and to protect the public health well-being of the individuals within our community. Each of them emphasized that they care more about making sure that people in their community are okay, more so than they care about being particularly on a panel. And I think by the time I got to Zamir, I was just so happy to be with a group of people that genuinely care about giving back to society. So I'm very excited to have them there. I've talked way too much though, so I'm just going to go into embarrassing them now by talking to them about their past. So this is for all of our panelists. We're going to go ahead and get started with softball here. So each of us, or each of you, have really done so much for our society, particularly in the course of the last few years. Can you tell us about what motivates you to do what you do? And this is for all of our panelists. Whoever would like to go ahead and get started first, or I can be embarrassing and pick somebody.
Hassan, can we take a step back and have you introduce yourself with the background you have? Because you have a very unique background. I would love to have the audience recognize that as well.
Sure, with the caveat that my background is probably the least impressive and the least important. And so with that said, I have a doctorate of pharmacy from the Albany College of Pharmacy and Health Sciences. I got that in 2012. In 2011, we have the opportunity as pharmacists to be able to practice being a pharmacist throughout the country. You have these rotations that you're required to do. I chose to do mine in as unique places as I could. I figured it'd be the only opportunity in my life to really do so. So I went out to Arizona. I worked with IHS for a few weeks. I went up to Alaska. I worked in the Air Force for a little while. Went down to Dominica, helped set up a rural healthcare clinic. I came back to the United States. I worked as a pharmacist for 3 years. That got boring, and so I went to law school. I got a graduate in 2018 with my law degree. I have a concentration in health law and policy, which basically just designates that I have an area of expertise in health law and policy. I had the privilege of working actually with two of my coworkers that are here today, Shannon Parker and Sako Narita, both of whom worked at the Baltimore City Public Health Department. We worked in it was at the Office of Public Health Preparedness and Response, and we had the pleasure of serving in 2018, right before the COVID-19 pandemic happened. And so as a team, we responded to that outbreak for 1.5 years of our lives. Shannon and Sako are two of the most incredible leaders I have ever met in my life, and I am so thrilled that they're here tonight. And now I work for the Congressional Research Service at the Library of Congress, and so my job there is to work with our congressional clients as they have questions related to the FDA regulation of various medical products and how to respond to large-scale public health disasters. So thank you for giving me that opportunity to talk about myself. But like I said, least important, least impressive. But you also now volunteered to be the first one to go. That's how that works. So could you tell us about what motivates you and why you chose to go into the field that you did? And then after you're done, if you could choose one of the other two speakers, that'd be great.
Sure, thank you. One thing I can tell you off the bat, anyone that's serving in, especially in public health, off the bat, they're not doing it for the money. So if we can get that squared away. Now, the next thing is the mission. My career, as Hassan went about talking about me, it's not a straight line. It's zigzag so much, even sometimes I wonder, how did that happen, right? So I actually joined FDA as a counterterrorism investigator after 9/11. So most of us who went through 9/11 was like, what can I do to help, right? As a Muslim, the attack was on us, like every corner you looked around. Everybody's looking at you different. There was like a serious identity crisis we were going through. And that's when I'm like, you know what? Why don't I go join the government and help them and see what's going on so they can see how Muslim can actually contribute. So I was one of the first Muslim joining FDA as a counterterrorism investigator. And from there, life just went on a different direction. I joined as a civilian. Later on, I became a commissioned officer with the US Public Health Service, and I started as a Lieutenant JG. Here I am after almost 20 years, 06 captain. But what motivates me is my family and the drive to serve others. No surprise here, my wife is also a commissioned corps officer with the US Public Health Service. So we both are serving the country in any capacity we can. We both are assigned to FDA right now. One thing I can say, during COVID, I think that was the first time I have seen the experience we built up over years, how that shapes your way of forward thinking, how we working in the FDA made FDA what it is now, and how we really change the legislation, the regulations to make sure we can really help the people who needs it the most. So I'm gonna pause there and I'm gonna pass it down to Sadia.
Thank you so much, Nazmul and Hassan, for the question. I came to public health pretty early in my life, as I had mentioned. I was an undergraduate. I had this very kind of traditional outlook. Oh, I guess I'll be pre-med and, you know, kind of pursue the South Asian path, so to speak. And I took a class on virology and immunology, and the professor had done this really fantastic job of putting the context in at the beginning of the class. So you had to like read about the social and the political context. And I was in love, right? I was just like, this is the far more interesting problem. It's the people problem. It's the understanding of how so many different dynamics come together and impact the health of populations, whether we're talking about the health systems, or whether we're talking about culture and stigma. And so I'm someone who loves people. I love interesting challenges and how do you unpack interesting challenges. And I felt like I found a home in public health. Similarly, I found that it provided me, similarly to Nazmul, it provided me with a really, really important part of my core identity, right? You know, as a Muslim, it is incumbent upon us to be sort of servants to our community in a way, right? And so how I realize part of my sort of iman in a way is through that practice of public health, through service. It's a mechanism to create more social justice in the world. And it's a mechanism to ensure that everyone has the opportunity to achieve as much as they possibly can in the world in this time that we have. So that combination of things, that ability to navigate different issues and to work on interesting problems and understand nuances, the centering of social justice, and that capacity to serve is just, I love public health for all those reasons. And Zamir, off to you.
Thank you. And I apologize for any delays. I had to, from using my iPhone instead of my laptop. The connection was a little shaky and I didn't want to be dropping in and dropping out of the call. But definitely going to echo a lot of, what both of the panelists so far have said. The journey, to public health definitely, has been winding and it's been zigzagging. And just full transparency, I never thought that I would be working at a philanthropy to do public health, which is different because I'm doing work for the public, but through an avenue that I would have never possibly imagined. Never was on my radar. I always thought that I was going to go into when public health got on my radar. I thought I was going to definitely be, in Health and Human Services, health department. Nazmul, we're definitely going to be talking about the Public Health Commission Corps after this because it is still on my radar in some ways. But I think the thing before I knew about public health is centered around not being okay with people being not okay. I wasn't okay with that. And I had no idea what I was trying to do, but I knew I needed to do something, so when going to community college, I'm like, okay, I'm going to do, well, before community college, high school, I was thinking about being a teacher. I was like, really want to craft the minds of tomorrow and really build them up. And then, it kind of molded a little bit. I'm like, okay, let's do another step, let's take it to another degree. Let's do a little bit more. And so I said, okay, psychology, sociology, there's this aspect of, the mind and the social situation that has, this a very big impact on people's outcomes and how they're living their life. And then when I was getting admitted to the community college, they were like, it's going to take you forever to get a check, doing psychology or sociology. So maybe you want to look at something different. And so I started doing more research. So then I said, okay, physical therapy allows me to teach people to really look at the psychological situation, the social situation, and also work directly with them to improve their health. So I'm like, okay, great. So I start off doing exercise and sports science. Extremely boring for those that I like playing sports, being active, but learning about it was one of the worst things I've ever done out of my entire educational career. I literally fell asleep during the first day, sitting front row in one of the exercise and sports science classes. So I needed to switch majors. So I went to global studies. I started learning Mandarin, which is extremely challenging. And I was like, I don't think I'm going to be able to make it through this program because I can't keep up with the history. This is very complicated for me. Took a test and I was one of the first people to finish. I said, okay, I'm in a class with a lot of people that are like from the Asian region and they're still in here taking this test and I finished. I need to drop it. I'm pretty sure I failed. And I actually passed that test, but I switched to anthropology before I got those test results back. But the anthropology piece really enthralled me because it was about people. I was focused on the medical anthropology and understanding how culture plays such a major impact on the health of communities. And so that's what got me started in looking at health. I actually ended up going and pursuing naturopathic medicine in the Pacific Northwest, for a couple of years. And while I was out there, Trump became president, saw a lot of, racism in a way that I had never seen it before, saw a lot of work that needed to happen. And so I'm like, I'm straddling this line between doing this public health thing versus doing this medical thing, what's going to have the biggest impact, what's going to resonate the most with me. And so I ended up leaving off the medical piece and going and focusing explicitly on, public health. And so that's what really got me into public health. And to the question of like, why am I doing this today and what motivates me, to what Sadia is saying is that, that amen, like this is a form of worship, for me, and that's one of the things that really keeps me going is that, this is a duty, this is a calling. This isn't just a job. It's not just a career. It's something that we're compelled, to do. And so that's why I continue to do it every day, because I mean, while we're still in COVID, but with the onslaught of COVID, I was like, I need to find something else. I can't keep up this pace, trying to do so much, but recentering, and putting my religion, at the forefront, top of mind, is the thing that actually keeps me going. And it's allowed me to have a lot more like balance and peace, every day with the work. So I'm gonna also start there because I can keep going on about this as well.
No, I mean, I think it's incredibly beautiful that you shared that. And I'm really grateful for all of our panelists for bringing that up. I think one of the things that we discuss as an organization is how do you give back to the spirit of service, and what motivates you and what drives you. And I think so many of our conversations are centered around this sense of we want to do more. We don't necessarily know what that more is. We don't know necessarily how we're going to accomplish that more, but we want to do more while we have the capacity to do more. And there are a billion different ways to go about that, but the important thing is that you get up and that you try. And I know that sounds like very hallmarky, and I know that sounds very silly, but at the end of the day, I think so much of what has been defined as success in our society has been traditionally obtaining a certain amount of wealth or obtaining a certain amount of property or obtaining a certain thing. And there is this, I think, growing recognition that we can do more and that we can be more, and that you don't necessarily have to rise to a level of a paragon, but you just have to try. And so what's apparent to me in each of these stories is that we're all trying, and it's something that I think is really, really beautiful, especially in the context of the next question that I really want to ask. And that I think, Samir, you kind of touched upon this. The last few years have been difficult for people in public health, regardless of what, I mean, they've been difficult for everybody. I think individuals who have been working in public health have faced a lot of challenges. There have been a lot of questions as to whether or not this is the right career path. And there have been a lot of challenges to what public health means. And I think it's difficult for individuals, or it might be difficult for individuals who are considering a future career in public health. And so what I'd like to do is to take a moment for all of us really to share a moment that was uniquely rewarding, to have a moment of inspiration for others. I know that for me, that moment was when I was serving during the vaccination campaigns that Baltimore City Health Department had organized. And that had really been a collaborative effort between my colleagues, Kim and Kay and Shannon and Sako, and our lovely Miss Bridget. And I remember that our team had spent so many hours putting that together and running simulations and thinking of things that we might have missed and trying to train people. And then the morning that we were able to welcome the first group of individuals in to get their shots, and as we saw those shots begin to go into people's arms and we recognized that our work was contributing in some way to this, was an incredibly rewarding moment for me. I know it was just the start of the next cycle of things, but it was the culmination of a community's full effort to try to make their community better. And so that is a moment I draw a lot of strength from. And so I would really welcome if each of our panelists today could share an experience within the last few years that really spoke to them and really reaffirmed that this was the right field for them to be in. I will let whoever, since that's not an easy question, I'll let whoever is brave enough to go first to answer that one.
Well, I'm not answering first because I'm brave, but I just have thoughts on it. So fun fact, I think like 2 weeks ago, I realized I worked in public health workforce development. Ironically, even though that's pretty much what was explicitly written in my job description, it just clicked 2 weeks ago that I'm like, oh, I actually work in public health workforce development. So I've been thinking and looking a lot more at the issues of like people coming into the field, people leaving the field. It's been top of mind a lot. But a rewarding moment for me, and there's actually it's been a lot. There have been a lot of very rewarding moments. I think specifically like while in the throes of, the early response for COVID, I worked with one of the state representatives in North Carolina to develop a COVID communities conversation Zoom, because everything was done virtually. And we built that out in a way where it was about having real conversations. It wasn't just about, leveraging some amount of fear mongering, just berating people and saying like, you're stupid if you don't get the vaccine, you're dumb if you do. It was more so about allowing people to have a space to have a genuine conversation with a local representative, but also with public health leaders, on the community level, as well as, the state level and a couple of national leaders as well. And to see that those conversations actually took up, very well, and that, we were answering people's questions and their concerns, because it wasn't that everybody just was an anti-vaxxer or anything like that. It's much more complicated than that. And so creating that space for people to be vulnerable, to have genuine dialogue. And we didn't get Zoom bombed, which is also a major plus. I didn't know that was happening like to everybody, but it really was rewarding to see that that space was created. And if I might have the latitude to actually talk to a more recent, rewarding experience, is like through working at the Beaumont, now being in this different vantage point that's very far upstream and very far removed from doing that day-to-day like service. Sometimes like what am I doing? Like, how am I making a difference? How am I making an impact? And Sadia, you can let me know how you felt about this experience. But I developed this thought leader summit, for our 40 under 40 in public health at the Beaumont Foundation. And it was one of the first times to get so many of our leaders that are in this cohort together, and to see everybody's space, to know that part of my job is to find out innovative and creative ways to support them, inspire them, to ensure that people aren't being burned out, and to get some feedback saying that it was like really great to have this community, to build these relationships with one another, was rewarding to me. And so now I'm looking at, how I can do that more. And Saudi, I'm looking at some great hotels for like our leadership retreat in San Antonio. So I'm trying to make sure that there's like free, unfettered like spa access for everybody. So, keep your calendar open. But I'll stop there. And I guess Sadia, like, tell me how was that experience? Like, you can validate me or you can critique.
Yeah, no, totally. Hassan, I'll answer your question. But experience was wonderful. And to have a collective together that is so focused on service, I think it is trying for people when you constantly are surrounded by individuals who may not quite understand why you think the way you do, why you're doing what you're doing. I've talked to, friends, siblings of friends who struggle really to sort of justify going into a field that was struggling, right? And so to be in that kind of community and to create space to share a network was incredible. I mean, one of the follow-ups from that leadership summit was that I actually spoke to people that I afterwards one-on-one that I wouldn't have necessarily spoken to, which as we create these stronger ties through our work, I think can only strengthen public health into the future. So Hassan, your question was, so Zamir, kudos first of all. And then Hassan, your question was about the last couple of years. So I work at a national nonprofit. We cover all 50 states, and the focus of the national nonprofit is to create parks and protect public land. Now, you all may be thinking, okay, so you're a public health person working at a conservation organization. This doesn't really make quite a bit of sense, right? But I think what was partially the most challenging and partially the most rewarding was the fact that the level of inequities we saw over and over and over again in terms of COVID outcomes, there was consistent conversation around the social determinants of health, right? This context that that your environment informs part of your health outcomes. And public health is in a position where on one side, you have sort of specific duties that we're supposed to be doing, right? Your 10 essential functions of public health. On the other side, we have this whole spectrum of challenges when it comes to what Zamir referred to as these upstream issues that we need to start thinking about much more intentionally, be active, play a more active role in informing what goes on in these social determinants of health. And so understanding that people now more than ever, the rewarding part was that understanding people now more than ever were turning to their outdoor spaces to get some form of mental health respite, to find some form of calm. That's how our the women and men and individuals were navigating having kids at home, were sending them to parks. This resource that so often had sort of gone ignored as sort of a nice to have in society just became a need to have really very quickly within a matter of a very short amount of time. And so being able to elevate that, being able to ensure that we understand the built environment, access to nature, that these aren't sort of things that are sort of givens, unfortunately, in the way our cities are planned. And then continuing to work on that, establishing partnerships around how we change policy toward that end in our urban spaces has just been super, super rewarding. The challenging thing, as someone who up until now has had their career very deeply entrenched in public health, so both at the local health government, at Baltimore City Health Department, I used to serve there, and then at CDC and the Peace Corps, very grassroots work, was not being where, you know, I'm one of those people who would be would like to be where the things are happening, right? But to be able to say, I'm going to support this system, I'm going to support the challenges that the system is facing by being on the outside and working in. So I think that's sort of both the rewarding and the challenging aspects of the last couple of years. Nazmul?
All right, thanks. So how you know the public health status is very good in any location when everything is working fine, right? It's when things goes out of control, that's when you're like, oh, we need to focus on public health. Unfortunately, that is one of the drawback on the attention on public health. Most of you in public service in any level, you know, if you're not in the front, asking for attention, you're not getting funding. So regardless where you are, whenever you think of public health, usually it's always on a back burner till COVID-19 happened. Now, all of a sudden, the focus is back on public health again. For any of you who are thinking, is it the right major or is it the right direction to go? My answer will be yes. And because you are in the United States, we are the only country in the world that has a fully dedicated service. And the name of that service is US Public Health Service. Need I need to say anymore? So join them, and then that's the best way to serve in that capacity. Now, the Hassan's question was very specific on during COVID, right? So during COVID, I was the program division director for import operation for FDA. My jurisdiction went from Northeast region, so from Maine all the way to Virginia. Every single airport and seaport was under my jurisdiction. So think of FDA regulated item, right? And Hassan mentioned devices. Guess where N95 falls under? Voila, right? And that's when millions and millions of N95 masks were coming into the country, right? This was the first time FDA, I mean, 20 years in FDA, this was the first time I was like, how do we handle this? The volume was coming so much. How do we distinguish what's good, what's not good? So that was the biggest challenge. And like anytime, whenever there is a crisis, right? People take advantage of that. Some people tries to make big money immediately, and some genuinely cares and wants to do the right thing. So one of my job was trying to make sure that all these N95s were coming in. So I'll share a quick story with you guys. In the middle of the crisis, we had 300 million N95 shipment that came through, and it was a very awkward shipment. It just from a Joe Schmo company coming from China, and I have never seen this company before. And as you can imagine, around that time, FDA did relax a lot of N95 requirements to make sure we give the necessary tools, especially for our first-line caregivers, to protect them. So a lot of rules are relaxed, and this shipment just showed up at JFK. It showed up at 9:30 p.m. And I get a call from somebody from the airport saying, hey, Naz, the shipment just showed up. You guys want to take a look at it? I'm like, you know what? I do. Because this company, I haven't seen them before. So it's 300 million N95 that came. So I had actually investigator that went to check that shipment and around 10. It came at 9:30. I had somebody out at the airport at 10. That's how fast things are moving, because we didn't want to delay any necessary shipment. These were life-saving devices at that point for nurses and doctors in the front line. We looked at it, he took pictures, sent it to me, something didn't look right. So immediately we called CDC, NIOSH, and we're like, can you guys please expedite this for us? We want you guys to run the test on this, and just to make sure that these N95s is up to the par. They're like, sure, Naz, we'll do it for you, no worries. We'll just put this stuff on the side and make sure we run this. I'm like, I need an answer as soon as possible. So we collected the sample that night, we sent it out that night, and it went to CDC on Saturday. CDC ran the test on Saturday. Meanwhile, I'm getting called from the press. Now they're threatening me that they want to go in public and say that FDA is holding their shipment when people are dying. Now you can imagine what that looks like, right? And in your mind, you're like, man, I'm trying my best, right? And so I'm like, you know what? Give me a couple of hours. I need to, something is not right about this shipment. And then we tested it, and the test results came back. N95, the way the 95 came, that mask actually blocks 95% of the particulates coming inside with that mask. That's how that 95 came. They did testing. Each one was around 30 or 35%. So at that point, I'm like, it was a good decision that we did, that we decided to hold it, and we decided to make sure we run it through. Don't give up under pressure. If your gut is telling you something is not right, and especially you spent a ton of years in that field, yeah, go with your guts. And then, so I went back to the media. I'm like, hey, we can do a joint conference. And they're like, oh, so are you gonna be listening? No. I'm like, no, everything that came failed. And they're like, oh. So either way, bottom line is we're able to save literally 300 million people who might have used that mask and thinking they are getting protected and that they did it. So these are some of the rewarding moments. Some of them are classified, I can't go into it. But we, in public health, do a lot of work that impacts millions and millions in a given instant and in a given decision you make. And I think we are doing a very good job putting public health out there so people can learn more and they can understand what public health is about. And I'm very proud to say we have Lieutenant Rizek. I see her dialed in as one of the audience. She also joined public health service recently, and she is our first hijabi sister who joined the service. So I'm very proud of her. Thank you. Good to see you.
I feel like I owe you a separate panel where I allow you to pitch the public health service, and so you and I could touch base offline about that. I try not to show how heavily biased I am, but I think it's very apparent how much I care about public health service. What I'd like to do is maybe do one last, maybe a quick round of questions to wrap things up from my end, and then we'll turn it to the audience in case the audience has questions, rather entertain those and have them hear my voice, and then we can wrap things up for the night. So last thing, and we can just keep this quick from all panelists. I kind of want to stress on that last point that we heard. What should we look for in the future? If you are an individual who is thinking about getting into public health, if you're thinking about the best ways to enter it, of how you can be best of service, what are some pathways that you guys would recommend, or what are some pathways that you guys would suggest to be able to enter into this field? We've kept in a break. Maybe, Sadia, do you want to start us off?
Sure. I'll go back to the point I made earlier that public health is a vast field, and there are multiple mechanisms to engage within public health, right? So first and foremost, you have your traditional local health departments, state health departments, feds. So the sort of traditional hierarchies of government. You also have a significant number of nonprofits who are delivering direct services. You have more and more now a variety of private sector healthcare firms, whether it's your payers, that's insurance companies, health insurance companies, or health systems, thinking more intentionally about the concept of public health. As you think about this, whatever path you decide to take, I would encourage you all to experiment, talk to people, network, read, right? Understand how different systems work. I like to say that we don't have one public health system, but we have 50 different public health, or 51 different public health systems, because every state is unique, whether we're talking about the variation in payment, whether we're talking about for the health services, whether we're talking about what's allowed in policy to be able to deliver public health services, whether we're just talking about the culture of the state, right? Like Americans, we have a national identity, and then we have really, really strong local identities. And then finally, in addition to all of this, think very intentionally, whether you decide to go into public health, whether you don't decide to decide not to. Public health comprises 3%. I'm going to lobby here, but public health comprises 3% of the national healthcare GDP. That is something that is unacceptable for what the purpose of public health is, right? It is to uphold social justice when it comes to health, and it is to serve the entirety of the population. In doing so, there has to be much more emphasis on local health system strengthening, local workforce support, national workforce support, because of the level of impact it's having on the people who are working in public health. We need new blood in public health, so really, really encourage you to do that. And we need the kind of people who are going to change the system and ensure that people are thinking much more intentionally about this space moving forward. I think that's it on my love for public health soapbox. I'm gonna pass it over to one of my panelists. I don't know, Zamir or Naz, if you want to jump in there.
All right, so I'll go. Bottom line is, I'm an engineer, so either I see black or I see white. I don't really see gray. I try to keep it very simple, and so far it's been working well for me and my career. Keep it simple. Find something that you really enjoy doing. That could be any field out there. It does not have to be a traditional doctor, engineer, or whatever have you, right? Find something that you love doing, because there's few things that's gonna happen. Once you find something you really enjoy doing, when you do it, it's not gonna feel like you are really exerting so much stress out there. You will enjoy doing what you're doing, and it will show. You'll move up very quickly. You'll make better network. So Sadia mentioned about that. That's the key component of any kind of job you want to grow. You have to do that networking. Once you do that, you'll find yourself in whatever direction you want to go. Now, all the panelists, we are extremely biased, including Hassan, because we're going to keep pushing you for public service. And I think, who else is on it? Ahmed Mati. He's going to tell you how to get in there with the USPHS jobs. Poor guy does it at nighttime, taking his personal time, and he does the excellent job doing that. But what it comes down to, you want to find yourself really enjoying what you do. You don't want to get up in the morning and, man, I got to go to that job again, because that's not what I do. I'm like, whoo, what am I doing today, right? Because I'm like, what's the next challenge today? So it's fun. And if you want to be in public health service, you don't have to come with a master's in public health or a public health background, right? I'm an engineer, look at me. And I'm wearing the uniform of public health service. I'm heck a good public health service officer. And so it really doesn't matter, but it does matter is like, do you really like what you are doing? And public health service now has a lot of attention, have a lot of openings. Even if you're a computer science guy, IT guy with the cybersecurity, you can still get into public health. But the beauty of doing public health in the United States, the different layers that you have, and Sadia really gave you the number, like seriously, feds, then you have the state, you have the local and city, and you have public and private compromise or public or even private industry owned public health work. There's so many venues to get involved with. And if you really have an interest in public health, this is the best time to do it. With that, I'm going to pass it to Zamir.
I'm here like taking notes from everything that y'all are saying. So I, because I'm learning, but also to not repeat everything that you all are saying. So one of the things that's top of mind for me. So I would encourage anybody that is interested in pursuing a degree in public health. Shameless plug for the Beaumont Foundation. We have a lot of research that is related to the public health workforce that is very beneficial. Talking about burnout, talking about the experience, talking about how many people are planning to even leave, the governmental public health workforce. And so I always think that that's very important to look at that, because there's two things you can take away from looking at that. And that specific resource is called PHWINS. So that's the Public Health Workforce Interest and Needs Survey. And that's a national survey that is conducted for governmental public health workers. And the reason I say that that's very important is because, one, it's going to highlight how much we need people in public health. Like, we need people in public health. We need more diversity, because presently public health is not the most reflective representation of the communities that are in most need of this service. So that's the first part of things. But then the second part is for you not to come in under any false pretenses, because as Nazmul said earlier, like, you're not coming in for money, like, you're not going to come in thinking that if you think you're going to come in and get rich, then probably want to think about something else, right? But it's very important to know what you're walking into, because it can be straining, it can be stressful. And so you need to make sure that you have the systems in your own personal systems in place to actually weather this. Because one thing, and this might be something more specific to me, some of this burnout that we're seeing is definitely from the work and the systems, but then I think there's a portion of it that's personal, where we don't know how to say, I need to take this one step at a time, and work on it piece by piece, because the issues are so vast. And so you put your whole heart into all of your work for a year, 2 years, a few years, but it's a lifelong job. You're not going to just see that issue that you're working on just vanish. It's not just going to end. It's hard work, but it's very rewarding work. And we have to find that middle and that in between, with going into this. Going to the governmental public health side of things, that's hard, because as Sadia said, there's not that funding, and as Nazmul said, is that we get this injection of money, for the public health, infrastructure in the workforce in these acute instances. And then it shrivels up, right now on LinkedIn, I'm seeing a lot of green bubbles of banners that are saying open to work, that are public health workers, and, the money from CDC Foundation, working at some of these places, they're like, okay, these contract positions where people were making six figures, when they were coming out of, their graduate degrees, now they're like, I don't know where I'm possibly going to work. I don't know what I'm going to do. And so it's very important to be mindful of the terrain in that and be aware of the other options, because I have not held an official paid position in governmental public health. You know, a lot of mine was finagling and finessing my way in to be of service and assistance. But the places where I got paid was in the nonprofit, you know, in the nonprofit space, even in this philanthropy I'm working on now, which is all about supporting, well, a large portfolio of our work is supporting the government and public health workforce. We're not a governmental organization. So there are a lot of options, you know, that are out there, you know, even, you know, and some people, there's always like a little bit of infighting, but, you know, consulting is a thing, you know, like there are opportunities to go into the consulting, you know, and also one thing that I appreciate that Nazmul said is that about, you don't have to have a public health degree to practice public health, you know. So one of the things that I was like really impressed with and informed that I received information for when pursuing medicine was that get your bachelor's degree in whatever, make sure you have your core competencies to go into that program, and then just like crush it in medical school. And I think we need to be advising people that are interested in pursuing public health that you don't necessarily have to go get a BSPH, you know, that you don't have to do this particular science, you know, to tee you up to go into epidemiology. If you know you want to go into epidemiology, then that's fantastic and that's great. But get a bachelor's degree that is going to have some value, you know, to whatever path it is that you are going to take. And then when you do, and if you do go into looking at your MPH, you still have this other core set of skills that you get to build off of, you know. And so for me, that's anthropology, you know. And so in the work that I'm doing, it's really looking at culture and it's looking at people and relationships. And so that's how I approach, you know, public health versus how some others might approach in a bit more of a prescriptive like capacity. Now, a step beneath the education piece, relationship building, you know, is going to be very, very, very important. You know, I'm moving away from saying networking because we're doing that wrong. Like people are doing a terrible job of networking, you know, but you got to build real relationships with people. You know, you got to do it early, you know, and it needs to be genuine, you know, it needs to be about, I'm interested in learning about what you're doing, you know, but that also helps you out a lot because you get to know, am I interested in going in this direction? Because a lot of things, because I mean, let's be honest, when people post a job, they want applicants, like they want as many applicants as possible to pick through. They're not going to say that this is one of the hardest jobs that you're ever going to have and that you're not going to make it. You know, you're going to hear about that when you actually connect with somebody on LinkedIn and you have that conversation. They're like, oh yeah, you know, I'm actually on my way out, you know, over here, you know. But building that relationship is extremely important. And I'm trying to do a better job of trying to carve out more time to mentor, because I think that's something that we all need to be doing, especially as Muslims in doing this work, you know, whether it's officially public service or tangential to it. You know, we need to be providing that support and guiding, you know, the generations behind us in doing this. And the last thing that I'll say, and I'm probably jumping all over the place, when you go in, if you go into this field, right, please do not go in thinking that you're just going to be doing this specific path and doing this one thing, because you're going to really limit yourself. Because in some ways in public health, you have to go with like where the funding is, what the issue is at that time. Like you're not going to, I was trying my hardest to get into Durham County Public Health and do health policy analysis. And then I found out you really don't do policy analysis on like the local level. You know, that's more of a state level thing. But I was doing everything to just do policy analysis instead of saying, let me have a versatile toolbox, get in here, whether that's being a community health worker or some other position, go ahead and get in there and then build out that work and then develop more specificity as time progresses. Because a lot of people do not start off doing what they're doing now in public health, you know, like unless it's like biostatisticians or epidemiologists, like that's probably one of the few clearly defined paths. But a lot of people, they go into policy, they say, I'm going to do government, they get into government, now they're in nonprofit. You got people that wanted to be in nonprofit forever, now they're in government. You got people who are going, so start broad and then work yourself down as you get more experience.
That was actually really beautiful, Samir. There's a lot of elements of not only what Samir said, but what our other panelists said that I wish I could go back and really hone in on. There were discussions on diversity and equity, which I think are incredible, which we could probably have a separate panel on. There were issues on mentorship and professionalism and networking, which if anybody knows me in my personal life, I struggle a lot with using the terms of developing our own brand and networking. I think people can see the look on my face when I'm asked to do that. And so to the extent that we can build genuine relationships with one another, to the extent that we can actually learn from one another as a community, that's really the kinds of things that I'm going to bring it back to MAPS now. MAPS was really started for. It's this concept that we can be nice to each other and things will work out. We can kind of be kind to one another and build a community, and we can learn from one another and be our genuine selves. And so long as we go back to that level of generosity and that level of we all as a community have things to share, maybe things can be better. Maybe it's a little bit idealistic of it, but it's the way that I want to be living my life. And I'm glad and really grateful for all the panelists that were here today, who allowed us to have that opportunity. So from here, I'm going to do a couple of things. I think there was one question in the chat. It looks like Nazmul was really quick and on top of it, so he's already answered it. I have Ahmad Mati, who is our chair. I want to give him a moment to, hop on, say a few words if he wants to. Don't want to embarrass him. If not, I will ask if anyone has any questions. They can either unmute themselves and ask or put in the chat. If our panelists have any last words, obviously I want to give it to them as well, but let's start with the opportunity to embarrass Ahmad. Ahmad, would you like to say something today?
No, thank you so much. This is awesome. This is not my area of expertise, so I've been listening and enjoying it. I will want to thank everyone before I go into the Q&A broadly, but also it's such wonderful advice. It's some of the things that were raised, of course, by Captain Nazmul, and also Zamir just mentioned something that I found was very interesting. I hear that a lot. People often, when I talk to a lot of people who ask questions about certain industries, I never realized how often this comes up. People often don't understand the policy-making process. So, like as you mentioned, they put all their eggs into a single basket. I'm like, whoa, nobody hires for that now, or that's not how usually they outsource. So it's like you really need to talk to people in the field to make sure you're on the right track. And I think that comes up a lot, and no one really mentions that. So thank you for highlighting that as well. But I'll stop there and let other people ask more substantive questions.
Sounds good. One of the things I want to pick on Ahmad for is that, Captain had brought up how Ahmad goes on these late night calls for professional development. I do want to pitch again, that is part of the suite of services that MAPS offers to basically anybody. And so to the extent that you want help looking at public service careers, and to the extent that we can help you be a part of a community, if you're not a member, please feel free to join. Even if you're not a member and you have questions, we're a pretty friendly group of people. So please feel free to reach out either on LinkedIn or via our website so that we can help you. Okay, I am going to open up the floor now either to our panelists if they have any last words, or to members of our community that are listening in case they have any questions. If not, I will let everyone go and have the rest of their Saturday evenings.
I do want to do a pitch in for our public health service. So like I told you guys earlier, I'm going to say it so it sticks. United States is the only country in the world that has a dedicated service dedicated for public health. We do a heck of a good job. When the Navy goes and does humanitarian work, the first troop they ask for is active duty public health service people to come and help them out. There's a difference. This is what we get trained for. This is what we do when disasters happen, natural, man-made, doesn't matter. We are the first one there in the first line to defend our country. And we do a heck of a good job doing what we do. I would love to see more Muslims to come in, because the more representation we have, the better we can cater it to ourselves. I was so happy to see Lieutenant Rizek come on board, because that was the first time I saw somebody in a hijab join. And immediately after, I saw a Lieutenant Chaudhary who had beard on, and that just got approved last year for Muslims. So there is already things happening. This is the best service to be in. It gives you really a way to give it back from a federal level, from the military level, to the state, to the city. You can actually go. How many times you looked at a hurricane and looked at, man, I wish I can do something. Guess what? You put this uniform in, you are there to help them out. That's the easiest way to define it. There is always a need for that. You can always serve. And public health, now you see it on the radar because of what's happening, but it is the best field to be in because that's the most impact you can have on population, your neighbors, your seriously, the whole country. You can have significant impact just by being in that field. That's it. Thank you.
We're honored to have you, and we're honored to have Jamla as well. Sorry, please go on, Samir.
No, you're good. You're good. I just wanted to also, even though I'm not in this, but a plug for the Ready Reserves, right? Because that got approved in the past like couple of years as well. So if you don't have the bandwidth to go all the way into the Commission Corps, there is the Ready Reserve option as well, which is almost like the reservist version of the Public Health Commission Corps. Is that correct? A fair statement?
Yeah, so public health service traditionally did not have a reserve component, but because of COVID, hello, everybody's learning, right? We realized most of the officers in public health service, we already occupy key positions within HHS. When you have all of us deployed, guess what? The agency themselves have a hard time trying to do and maintain their work, even though our civilian counterparts do volunteer to help us out, but this reserve component is going to bridge that gap. So there's a lot more information out there on the reserve component. You can actually be in the field doing what you are doing and sign up for the reserve and can help the country when you get the call. So thank you, Zamir, for bringing that up.
Oh yeah, no, I'm looking into it. So I wanted to bring that up. I guess what I'll just say, if nobody's hand is raised and there's no question, even though I've like talked about some of the ugly parts, the ugly bits of public health, I'm like a very pragmatic and open person. It's a very beautiful field. There's a lot of great things that are coming out of it, and there's a lot of potential for growth in this space. And so the thing that I would advise anybody, one, I would encourage people to continue to go into the public health field, to continue to go into this work. We need it. We really need it. But then on top of that, I would just say be prepared to work. You know, this is not going to be like the cushiest of experiences. It doesn't have to be the most tumultuous, you know, but you definitely need to be prepared to work, because in some places I'm seeing that people really aren't willing to put in that legwork to build relationships, to make connections. You know, you're gonna have to put in more energy, you know, in the public health field. You know, you're gonna have to be focused a lot more on that professional development. But one thing that I always stress is the personal development. You really have to know how to regulate yourself, set your boundaries, how to protect your energy, you know, and your mental well-being while doing this work, because it's very daunting, it's very taxing, very rewarding. I would encourage people to do it, but you really have to have a lot of self-advocacy and self-awareness to do this work.
Thank you to Nazmul and Zamir both for your thoughts. In terms of my final thoughts, I have a couple of things that I want to share. As you're thinking about public health, there's something that we didn't really touch on, but I'm going to bring it up at the very end when it's probably no time to unpack it. But 70% of the workforce in public health in health care, in social care across the world is made up of women. Yet 25% is made up, the leadership, 25% makes up leadership, right? So as we're thinking about this, I see a lot of women who are on the call. I encourage you all to really make sure to intentionally think about relationship building, so that you have an understanding of how the system works. There are so many times that one conversation has changed the way that I understand what I should be doing to move my career forward. And we don't always think intentionally about what is going on behind sort of what's listed on the website or what is sort of listed in the job description. So encourage you all as you approach public health to be very intentional about that relationship building and be very bold about understanding the inner dynamics of how systems work, whether it's governmental or non-governmental public health.
And one of the things I'm trying to do a better job of is, so I don't know if you were part of the thought leader summit, but were you there when our comms team came and talking about health?
No,
Okay,
I got the
it's
flu that day.
recorded. Oh no. But so one of the things is that they really express that stories are facts wrapped in emotion, and that's one of the things that really like sticks, in some ways. So I just wanted to I don't want to say piggyback on a Muslim call, to build off of what you're saying, is that for me, that intentional relationship building has been core to how I've navigated through the field. And it's been based in building genuine relationships. I feel like part of the reason I'm at this foundation right now, it was 3 to 4 years in the making. It wasn't, oh, the job was posted, I went for it. It was because I had built some level of rapport in knowing some of the staff. Before I even knew that I wanted to even work there, I was like, the work that they're doing is cool. I want to talk to the CEO. I want to talk to the chief of staff. I want to talk to other members of the team and just know what they're doing, just so I can understand the field better and understand the work that they're doing, that is being done. And then when the jobs came up, I could really say that I was excited. And so when I actually got on my interview, I was genuinely excited, and so it wasn't just that fake, like, oh, I'm really excited to be here. Like, I know the mission statement, I know the vision, and I'm going to continue to drop that into conversation. It was actually because a relationship was built. And recently I had the opportunity to go to Aspen, for the Aspen Ideas Festival. And that was based off of a relationship, that I built from somebody that really had no relationship to Aspen specifically, but it was through North Carolina Department of Health and Human Services. I actually built a good bond, stayed in touch. And then just every couple of months, I send out an email and I say, hey, this is what I've been up to. This is what I've been doing. Would love to touch base sometimes. Very low lift. And then I'm top of mind when things come up, and it just continues to build out like my portfolio and my work. But it's really those genuine bonds and connections. And then Hassan, for you, maybe don't think about personal branding, but just think about personal identity, because I'm really tired of like all of the flexing, like on LinkedIn and like some of the self-promotion, myself. And I'm like, okay, I don't want to do the whole personal branding thing. I want to just, what is my identity, and how am I presenting myself comprehensively when doing things? And it's making work a lot easier, like I'm just who I am, in every situation. And it's very refreshing, but yes, build relationships.
I really want to emphasize that point. I think for a lot of us growing up, at least, I don't know about you guys, I grew up in upstate New York. Alhamdulillah, I have very good friends in that area, but there was not a lot of people that looked like me, especially not in my classes. So a lot of the times when I thought about what I wanted to do, I was kind of isolated, kind of in a bubble. And so the opportunity to be able to express who I am, to express my identity, has been something I have done, I think, in spite of everything that has happened. And it's something that I have found a lot of empowerment from personally as I grow into my career. But it is something that I find so rewarding when I have the opportunity to speak with people like our panelists or people like our MAPS members at our events, people who just genuinely care about the thing that they want to do. And that's something I think that unites all of us. So thank you all for who you are. Thank you all for our panelists. I am not going to kick anybody out because I'm not that cool. But I think this might be a good place to call for our guests if they want to leave, or our panelists if they want to get going. I know that everybody has an extremely busy schedule and I don't want to keep anyone. But I do want to reiterate how grateful I am to have met all of you. I'm so grateful for the three of you for hopping on. Dr. Faisal Khan, the Seattle Public Health Director, reached out to me. He has COVID. He expresses his sorrow for not joining, but he says that he is unable to stop coughing and that he wishes that he could be here with us, and that he is deeply sorry. But I am incredibly grateful for our panelists that are here today. All right, guys, let's do one last round of, do we have any additional questions from the audience? Going once, going twice. Panelists, would you like to say anything before we end the call for tonight?
Hassan, one comment from me. Being in the uniform makes a lot of difference. The Sergeant General, Vivek Murthy, this is his second term he's doing. But in the last term, he actually tweeted about me. And I had a little discussion with him. And in that, he literally said, came from a diverse background without a valid identity, but now is known as an officer of the Public Health Service. And that was very profound because all this identity we are talking about, put the uniform on and everything becomes behind the scene. And you are the face of public health and you just keep moving on. That's all I have to say. Thank you for having me.
We move forward as a team, and I think we're going to have additional conversations, I think both privately with you about the Public Health Service, but then I think maybe more as an organizational thing, if you want, or if you feel comfortable sharing, I think some of your experiences with MAPS as a whole, I think there might be opportunities there to explore, but I'll bother you about that later.
And thank you to the panelists. You guys are amazing. Keep it up.
Yeah.
Thank you, Hassan, and all of the sponsors who brought folks together. And thank you for everyone who attended.
Absolutely. Yes. I just want to be able to actually say Jazakallah khair and have people understand what I'm saying in a public space. You know, like all of the alhamdulillah, inshallah. I'm like, this is great. I need more of this. So no, but thank you for having us. You know, this has been, really rewarding and refreshing. Please connect with me on LinkedIn. You know, I would encourage you to connect with everybody. You know, if you haven't done so already, we have to continue to build out these relationships and these ties. You know, it's very important.
And if you guys are in the DC, Maryland, Virginia area, we're going to be doing an in-person live event later this December, inshallah. We'll have information posted on our website. If people want to be connected with our panelists, please let me know and I will help to facilitate that conversation to the extent possible. I am here to help you to whatever degree I can, but it's been a pleasure serving you guys tonight. It's a pleasure being with you guys tonight. Assalamu alaikum.
Thank you.
Thank you all.
Have a good night, everyone.
Thank you, Hassan.
You're welcome.